Now what are the various glycoproteins among the hormones in structure? FSH, LH, TSH, HCG, alpha-fetoprotein, erythropoietin. They are all examples of the hormones which are glycoproteins. In cardiac tamponade, because the filling of the heart is impaired, the pumping of the heart is impaired. Because the pumping is poor, the cold clammy extremities due to the shock is what you typically see rather than warm extremities in case of the cardiac tamponade. Probably the easiest question on cardiac tamponade ever given in any entrance. Will cardiac tamponade cause JVP distension or not? Kind of a simple question this is. Actually we are expecting what will be the cardiac catheterization findings that differentiate restrictive from that of a other types of cardiomyopathy. They are all classical questions. You can expect them in the next state entrance probably. There is one table you should be sure on any medicine book you read. Cardiac tamponade, restrictive cardiomyopathy, constrictive pericarditis. How do we differentiate clinically and catheterization findings? Where do we find the equalization of diastolic pressures? Everything you should be very sure. Now hyperkalemia can occur with succinyl-choline, as all of you know very well. Dicritic notch, dicritic pulse is a typical pulse of the low cardiac output which is found in the dilated cardiomyopathy patient. Somebody who is an alcoholic, you can see a typical dicritic pulse is what need to be remembered. Now if you take malnourishment, the loss of the buccal pad fat is a little late sign, but the loss of the turgor in the skin that becomes wrinkled and loose with the loss of the subcutaneous fat is one of the very early and sensitive indicators of malnourishment. Is what need to be remembered. Severely malnourished child, severely malnourished is a late finding he is looking for rather than an early finding. Then late finding would definitely be the loss of the buccal pad fat pad by that context. Huh? Correct. So one of the options was that, I mean these are the same 4 options, right? Malnourished? No, basically in marasmus subcutaneous fat also will make the skin to lose the turgor. Need not always be a sign of dehydration, it need to be. Even it can be a sign of malnourishment also. But the question is, it's a very early sign of malnourishment in marasmus. But examiner is asking severely malnourished child, which is he is expecting you to tell what is the late finding, but once more the word sensitive means very early finding. So what is the early finding of a late consequence of the malnourishment? Other way to read this question. So I am not sure what was there in the frame of the question. Now with blood transfusion, when lot of citrate is pumped in massive blood transfusion, citrate sequesters the calcium and lead to hypocalcemia rather than hypercalcemia. Now what are the various symptoms of rabies encephalitis? This is a very good question. Fundamentally the rabies manifestations are being divided into encephalitic form, which is called furious form, and paralytic form, which is called as the dumb form. So if you look at the evolution of the encephalitic form, initially patient will have fever, malaise, pharyngitis, paresthesia at the site of the bite. Then hydrophobia, aerophobia, agitation, hypersalivation, seizures, etc. will take over. Accordingly there is a prodrome, neurological stage and late symptoms. That is how we divide the rabies encephalitis clinically into different phases. So there is a reason, doctor, paralysis, paresis, aphasia, incoordination, they are all the part of the neurological stage. So that is the reason hypersalivation, limb paralysis, hydrophobia, they are all very well identified findings in rabies encephalitis is what need to be remembered. Carcinoid is the most common appendiceal tumor, and the most common site for the carcinoid also is the appendix, as all of you know. The mucinous cystidenoma of the ovary leads to development of pseudomyxoma peritonei. Then what are the various COX-2 selective inhibitors? I find two inhibitors in them, that is the coxibs, rituximab and itracoxib, but tinoxicam and meloxicam, either of them are all oxycams. All oxycams are basically non-selective COX-2 COX inhibitors of both COX-1 and COX-2. So I find two answers. I don't know what whether really examiner gave both the options. He gave both the options? You don't remember, right? Now let's go to the next question. What does Falx cerebri basically contain? Falx cerebri is that sickle shaped arched fold of dura mater, and the upper border of it contains superior sagittal sinus, inferior contains inferior sagittal sinus. So sagittal sinus is the one which is a venous sinus which is located within the Falx cerebri is what need to be remembered. The Clostridium perfringens typically produces rectangular spores which are non-motile in nature. Magnesium should never be given in a patient who has got myasthenia gravis is what need to be remembered. What is Poem syndrome, doctor? Polyneuropathy, organomegaly, endocrinopathy, monoclonal gammopathy and skin changes. The combination which you find in is in case of the gamma globulinemia is typically called the Poem syndrome. Tumor necrosis factor is called the catetin 1. Then myoclonic epilepsy, Leber hereditary optic atrophy, they are all mitochondrial inheritances but not Huntington's chorea, which is a autosomal dominant disorder. What is the rule of 10 when it comes to the cleft lip surgery, doctor? The Musgrave's rule of 10. At least 10 weeks of age, 10 pounds, that is around 5 kgs of weight, at least 10 grams of hemoglobin, and the father should be ready with at least 10,000 rupees to pay your bill. So that is the plan of the rule of 10. Then medullary carcinoma of thyroid has got a amyloid stroma. Immunoglobulin A in the mesangium is what you find with Henoch-Carlin's purpura. Now this is a good question, doctor. Where do you find carcinoma of the stomach very commonly? The stomach has got a cardia, the fundus, the body, the antrum and pylorus. That's how we divide it. Before 1950, most of the gastric tumors are detected in the antrum, but after that the recent statistics show 40% are in fundus and only 30% are in antrum and 30% in the body. So fundus and cardia. Fundus is the most common site of the carcinoma of the stomach in the modern era is what need to be remembered. Now general osteoporosis with Wormian bones with multiple fractures is a classical story of osteogenesis imperfecta, which is called the brittle bone disease. Revised national tuberculosis program, doctor. 6 to 8 objectives are there. Everything you should read and remember thoroughly for the tomorrow's exam, whether you want to be a pulmonologist or not, whether you want to practice in India or not, if you want to win the entrance in India. So what is the goal of DOTS? Cure rate of at least 85% in the new sputum positive pulmonary TB and detection of at least 70% of cases is considered to be the goal in case of the DOT strategy is what need to be remembered. We call low, medium, high tracheostomy. It is all the reference is thyrohyoid, cricoid, hyoid membrane and cricoid cartilage is the important landmark. The middle ear cavity will enter into the anteriorly into the eustachian tube, which is opening into the pharyngeal cavity, as all of you know very well. Then what are the peroxisomal marker enzymes? Catalase is one enzyme and uric acid oxidase is another enzyme which are called the marker enzymes. They are all exposed to the background radiation which is terrestrial, which is contributed mainly by the radon, is what need to be remembered. Not only the the bagasosis is very common in the paper mill workers, is what need to be remembered. Then cell wall synthesis inhibitors include bacitracin, cycloserine and amoxicillin, etc., etc. What was the fourth option? Was it dactinomycin? Which is not so. So I leave to you the literature, what are the various mechanisms of action. Aminoglycosides, tetracyclines, chloramphenicol, macrolides, and they are all inhibitors of protein synthesis. Whereas the penicillins, cephalosporins, monobactams are cell wall synthesis inhibitors, and quinolones are the DNA gyrase inhibitors, and etc., etc. It's up to you to review this. In the hair cells, in the cochlea, what is a very important in the organ of Corti, the hair cells, what movement makes the electrical potentials generated? It is the positive ion movements. What positive ions? Calcium and potassium, they are the two important ions. Once more, is it efflux or is it the influx is the question. It is the influx of the positive ions, mainly potassium. So K plus influx is the one which will lead to the generation of electrical potentials, is what need to be remembered. Now what are the most common site for the mandibular fracture? We should remember that body fractures are very common, but body was not given. Following body, it is the condyles, second most common location, then angle of the mandible, the second best would be the 21 to 40% is body, 20 to 31% is angle. So angle should become the answer, because 15 to 20% is condyle. So condylar is second, third most common. So angle is the second most common, and in these four options it is the first most common. So angle of the mandible is the most common site out of the sites given. Then cartilaginous has got sinusitis, bronchiectasis, sinus inversus, situs inversus, they are all the important components. Infectious mononucleosis, nasopharyngeal carcinoma, and the Burkitt's, they are all EBV. What is cause for the Kaposi, doctor? Human herpes virus? 8, right. Then TB classically lead to multiple perforations. This is a very classical question. And out of all these tumors, it is the embryonal rhabdomyosarcoma which is the most common tumor in the orbit. Then ansocervicalis, many times we discussed in our full scale mock tests. So all the four infrahyoid muscles, sternohyoid, sternothyroid, omohyoid, they are all innervated by the ansocervicalis, is what need to be remembered. In hypocalcemia, what is an important ECG change? QTC become prolonged, ST interval become prolonged. They are the important changes which we see with the hypocalcemia. Out of all, the maxillary sinus, which is the first sinus to develop, is what need to be remembered. This is a good question. How is the CSF from the scala vestibuli and scala tympani will drain into the subarachnoid space? We struggle in exam between what is this cochlear versus vestibular aqueduct, very common. So we should know that it is the cochlear aqueduct which will be leading to a tubular prolongation of the dura mater and establishes a space which communicates the perilymphatic space with that of the subarachnoid space, is what need to be remembered. What is vestibular aqueduct? I leave in the literature for you to review. Now what does carotid sheath contain? Common carotid artery, internal jugular vein and vagus nerve, they are all the part of the carotid sheath. Pain, fever, jaundice is the classical Charcot's triad, as all of you know very well. One question on STDs, without that there is no paper. Amsler's criteria, any exam you go, it is a routine question. So clue cells are classically found. Schiller-Duval bodies are typically found in the case of the endodermal sinus tumor. Now one more question on classification. So you will be clean bold, doctor, if you have not read the topic of ovarian tumors, testicular tumors, at least their classification. So you should be sure that the sex cord gonadal stromal tumors are divided into the sex cord, gonadal stroma and mixed. That is how we divide it. In the ovary granulosa cell tumor is the sex cord gonadal stromal tumor, similarly thecoma and fibroma. And in the male testis it is the Sertoli cell, Leydig cell, Sertoli Leydig cell is there are the various sex cord gonadal stromal tumors. So granulosa, Sertoli, Leydig cell, but yolk sac does not fall into this, is what need to be remembered. Type 3 hypersensitivity is immune complex mediated, SLE leads to a photosensitivity rash. Pathological myopia occur with the people with big eyes or small eyes, Chinese or Indians. So big eyes. So with big eyes the anterior chamber will be not shallow, rather it will be deeper. So it is not shallow, rather it is a deeper anterior chamber, which is a feature of the pathological myopia, but it can lead to degeneration of the retina posteriorly, leading to retinal detachment, etc., etc. Now one question on retinal detachment will be there, exudative, fractional, what is one more? Regmatogenous. So the proliferative diabetic retinopathy, retinopathy of prematurity, penetrating trauma, sickle cell retinopathy and retinal venous occlusions, they are all the part of the fractional retinal detachment is what need to be remembered. If there is a postural hypotension, if you want to manage, we use a drug called midodrine, which is an investigational alpha agonistic drug which acts like a vasopressive and anti-hypotensive agent by being a alpha 1 agonistic drug is what need to be understood. This is a very good question. I had been waiting for this question ages together. One question on hypolipidemic drugs, definitely every entrance, and or otherwise one question on hyperlipoproteinemias in medicine, or even that is forgotten by examiner. He won't leave you in biochemistry on one question on lipoproteins. So you have to be sure which apoprotein is for which lipoprotein, which carries triglycerides, which carries cholesterol, etc., etc. So doctor, cholestyramine like bile acid sequestrants, whenever you are using, you should be very careful. If somebody has got hypertriglyceridemia, it is a contraindication to use the bile acid sequestrant is what need to be remembered. See, hyperlipidemias are of two kinds, hypercholesterolemias and hypertriglyceridemias. For cholesterolemias you have lot of drugs, statins, etc. For triglyceridemias mainly exercise, lifestyle modification, fibrates, fibric acid derivatives you can use, but never use the bile acid sequestrants is a very important role. One question on antidiabetic drugs, you should be 200% sure about this topic, doctor. So the rosiglitazone, pioglitazone, all these thiazolidine derivatives, they are all the stimulants of peroxisome proliferator activated receptors called PPR gamma. So they basically sensitize the insulin receptors and decrease the resistance. That is the main function of this group of drugs. Sucralfate, very common mistake done by us is we tend to combine one ranitidine with sucralfate and write a prescription to the patient. You can write, but you must tell him that 2 hours of gap must be there between your white fluid sucralfate ingestion and that little pill which takes care of your abdomen and pain abdomen. There must be 2 hours of gap, otherwise the ranitidine cannot show its influence and effect, and it won't be well absorbed. So phenytoin also get affected by the sucralfate, digoxin also get affected, but phenoxymethylpenicillin is not affected by the sucralfate, or for that matter with the food intake. You can very much combine the phenoxymethylpenicillin. Insulin stimulates, not inhibits, the sodium potassium ATPase is what need to be basically remembered. In brucellosis, what is the mainstay of treatment, doctor? You all know endocarditis can be due to brucella, milk ingestion is true, but only fighting is between cephalosporin versus ankylosing spondylitis. Anyway, you will confidently answer cephalosporin is not the treatment of choice, because you are all now sharp exam going students. But what is this ankylosing spondylitis? The point is, brucellosis also leads to the enthesitis, inflammation of the tendinous insertion and ligamentous insertion on the joints, just like ankylosing spondylitis. So similar clinical picture will be there. But what is the treatment, doctor? Tetracyclines, aminoglycosides, rifampicin, they are the major part of the management of the brucellosis is what need to be remembered. Now what are the various branches of the facial nerve? But before that, lingual nerve is not a branch. Lingual nerve is a branch of the mandibular division of the trigeminal nerve is what need to be remembered. The facial nerve branches are the greater petrosal, nerve to stapedius, chorda tympani, posterior auricular, and posterior belly of digastric, stylohyoid, like a parrot you must rattle out in the tomorrow's exam. Now what comes from the posterior cord of the brachial plexus? Upper subscapular nerve, thoracodorsal nerve, lower subscapular nerve, axillary nerve and radial. RATS, R for radial, A for axillary, T for thoracodorsal, S for subscapular. RATS is typically the origin of the posterior cord derivatives of the brachial plexus is what need to be remembered. This is adenocarcinoma. Generally, where are adenocarcinomas located, doctor? Central or peripheral? Remember, small cell, squamous cell, SSC exam. Small cell, squamous cell are central. Adeno is peripheral. Any tumor peripheral easy to resect. So that is the reason surgery is one of the major options available for the management of the adenocarcinoma. And adenocarcinoma is very poorly responsive to radiotherapy or chemotherapy. So pneumectomy, lobectomy are considered to be the management of choice of the adenocarcinoma is what need to be remembered. If there is a benign meningioma, how do you want to treat? You can observe also. Every meningioma don't need treatment. But meningiomas can be surgically resected. But whenever you are resecting, be very sure to resect along with the dural sheath to prevent recurrence. So that is the main objective of the surgical resection. So accordingly, Simpson's criteria had been advocated for the management of meningioma. If it is grade 1, complete removal including resection of the underlying bone and associated dura. If it is grade 2, then complete removal plus coagulation of dural attachment should be done, and grade 4 should be subdural resection. That's how you do. And when do you like to consider radiation therapy? If it is a WHO grade 1 meningioma and you have done subtotal tumor resection which is incomplete, then you need to supplement that with the radiotherapy, and they are quite radio responsive in nature is what you should be very sure about. Now what is a very specific feature of increased intracranial tension in adults? Basically copper beaten appearance and sutural diastasis is what you find in pediatrics, not in adults. So Selleterschika's erosion is a feature. If already sutures have fused in the adults, one of the sign of a prolonged intracranial tension is what need to be remembered. Now there is a bitemporal hemianopia with galactoria, amenorrhea, then what is the most likely diagnosis in this case? There is a small fix about this question. Let us talk about that. How are the pituitary adenomas are classified into? They are basically classified into micro and macro adenomas by virtue of the size. if it is more than 10 mm or less than 10 mm. Then they are based on functional status divided into non-functional and functional, whether they can produce hormones or not. Now, a macroadenoma is recognized by its compressive features which compress the optic chiasma and lead to bitemporal hemianopia. But at the same time, a macroadenoma can compress the pituitary stalk, and that will prevent dopamine from acting as an inhibitory hormone, inhibitory substance on prolactin secretion, that can cause hyperprolactinemia, which can cause galactorrhea and amenorrhea. So that is the reason it should be definitely a pituitary macroadenoma, it need not be prolactinoma. It can be a pituitary macroadenoma which is compressing the pituitary stalk, can be possible. So option D is equally a good option. But at the same time, if it is a prolactin secreting pituitary macroadenoma, even that can explain all the clinical features given. I don't know what is there in examiner's mind. Examiner has no choice of facing the students, right? So he can compose a question. Whereas in our Sunday test we always have a chance to face a debate from the heated debate from the students. Now 760 millimeters mercury at atmospheric pressure of oxygen, I think option C would have been 160 or 158, something like that, because that is the truth. It is 20.9% of 760 will give you 159 millimeters of mercury is the PO2 at the sea level, is what need to be remembered. Bicarbonate typically occur with the carbonic anhydrase inhibitor like drug, which is acetazolamide, is what need to be remembered. What is thiazide diuretic basically will be responsible for? It will lead to hypokalemia, increased serum cholesterol, hyperglycemia, impotence and diabetes mellitus. They are the various manifestations of thiazides, is what need to be remembered. But do we use thiazides therapeutically in any situation, is my question to all of you. Thiazides lower the urinary calcium excretion, and that makes them very useful for preventing calcium containing kidney stones. There are conditions like familial hypercalciuric hypocalcemia states where excessively kidney is losing calcium. You must stop that losing tendency of calcium by the kidney. For that you can use thiazides which will retain the calcium. Similarly, thiazides are helpful in somebody who has osteoporosis because they retain calcium and try to help in mineralization of the bones very well. So that is the reason hypercalcemia, hypokalemia, hyperglycemia are all caused by thiazides, is what you should be very sure about. What is the spectroscopic color of methemoglobinemia? We don't know what is spectroscopic color, but we know what is the natural color. Natural color of the methemoglobin is different from spectroscopic. Okay, what is our literature review shows us? There are 4 absorption bands spectroscopically if you examine the methemoglobin. One narrow red one which is very specific for methemoglobin, 2 pale yellow green, 1 wide blue. Because more specific is narrow red one, I like to consider option C, red, as the answer for this question. It is only Dr. Google Guru who provided this answer. I am not sure any books really talk about. Biochemistry laboratory manual may be having this, but we all have thrown the laboratory manual after passing biochemistry, right? Now brownish discoloration of the teeth is because of the tetracycline. Hypercalcemia, this is a very good question. Tell me, doctor, what is the most common cause of a very long standing hypercalcemia? Malignancy, always you should rule out. Hyperparathyroidism also responsible. But we should also remember any high bone turnover condition like hyperthyroidism also lead to development of hypercalcemia, is what need to be remembered. That's the reason the odd man out in this would be tamoxifen, which is ruled out. What is explicit memory and what is implicit memory? Explicit is the conscious, intentional recollection of the previous experiences and information is explicit. Whereas implicit memory is previous experiences aid in the performance of a task without conscious awareness. So all the entrance preparation is explicit or implicit. It's all explicit. You have to scratch your brain in the exam hall to remember what all you read in anatomy. But to practice as a consultant, oh, in sleep also you will start writing what is the dosage of atropine you have to give, when to intubate, when to not. So finally your knowledge is definitely based on past experience, but consciously you are not working out. So that's the only difference. So explicit requires some conscious recall of the past memories is what need to be remembered. Now what is delirium? Delirium is not insidious, rather it is acute onset, consciousness is impaired, and there is a derangement of a wide cerebral metabolism in delirium. That's the reason there is a toxic delirium, metabolic delirium, different causes of delirium, as all of you know very well. What is dyslexia? Whenever we talk, doctor, so many processes occur. The Broca's area will organize the pre-spoken speech, and parietal lobe will be trying to receive the visual data and then will be sending to visual cortex. And there is a Wernicke's area which is a comprehension, what others are talking you will be knowing by using that. But overall dyslexias are all because of the problem with the left temporal lobe in the brain in the right-handers. In the right-handers, left temporal is a dominant temporal lobe. Dysfunction is responsible for the dyslexia is what need to be remembered. Type 2 diabetic individuals are prone to have very hyperglycemic levels which lead to non-ketotic hyperosmolar coma, as all of you know very well. So what is the Axin's tumor? It is the primary neuroectodermal tumor of the chest wall, is called as the Axin's tumor, but this is only a fancy question of examiner's delirious state. Now H. pylori can lead to development of gastritis with anti-gastric parietal antibody generation in about 65% of patients, leading to a tendency for developing pernicious anemia of megaloblastic nature is what need to be remembered. Now what is the most common site of the sterilization? Interstitium or ampulla? Most common site of fertilization is ampulla, right. Isthmus. The most common site of fertilization, the next question that follows would be the ampulla. Now what are the complications of vasectomy? If you are very gross, crude, learning surgeon, scrotal hematoma can occur, then infection can occur, anti-sperm antibodies can be generated, but loss of libido is never a part of vasectomy. Vas has different channel, libido has a different neurochemistry, so nothing get affected. But commonly patients ask you, do I lose libido, etc., etc. So you should ensure them, rather you can say no, in fact it may get enhanced is what you can promise, and but finally complete the vasectomy in this populous country. Now acute emphysematous cholecystitis is because of the Clostridium perfringens in elderly people. What is the difference between regular cholecystitis, acute cholecystitis? It is common in not elderly people, but diabetic elderly people are more prone to emphysematous cholecystitis is what need to be remembered. Staphylococcal scalded skin syndrome is also called as a Ritter's disease, as all of you know very well. Now what lead to toxic shock syndrome of Staphylococcus? It is a super antigen which is non-specific in its binding with the MHC class 2 and leads to polyclonal T cell activation, and that is how the staphylococcal antigen acting as a super antigen will stimulate an intense inflammatory reaction in the body and lead to the development of the toxic shock syndrome. How? This is basophilic inclusion bodies, where are they found? What is a regular fancy question of examiner? Which inclusion bodies are Cowdrey type A, Cowdrey type B, which are intracytoplasmic, nuclear, both intracytoplasmic and nuclear? But the examiner knows, you all know those answers. So this time acidophilic, basophilic, red looking, white looking. So let us look into it. The rabies negri bodies, smallpox guarneri, molluscum contagiosum's Henderson Robertson bodies, Bollinger bodies of fowl pox, and halberstated Prowazaki bodies of trachoma, they are all intracytoplasmic. Then internuclear are divided into Cowdrey type A and type B. Type A are herpes called Lischbuck's antibodies, inclusions. Yellow fever stories bodies are Cowdrey type A. Cowdrey type B is adenovirus causes basophilic, poliovirus causes acidophilic, and Warthin-Finkeldy inclusion bodies in measles are fundamentally both internuclear and cytoplasmic. End of the story. You don't need it after you get the seat. Until then, take an opportunity to threaten your classmates with all your extra gyan on inclusion bodies. We leave this for a literature for you, don't worry. Then one question, doctor, gonococcus, granuloma, syphilis, LGV. Without that, the STD clinic of entrance exam hall is not closed. So you should be sure on how will be single ulcer, indurated ulcer, non-indurated, painful, painless lymphadenopathy, everything you should be sure. So a beefy red appearance is a very important clue. Painless, friable, beefy red granulation is a classical feature of granuloma inguinale, or donovaniosis is what need to be remembered. To remove confounding effect, we do matching, randomization, standardization, etc. basically to remove the confounding effect. If you use topical steroids, what will happen? It can lead to both glaucoma and also cataract, but glaucoma more commonly than cataract. So otherwise I consider if more less are not given, then both option A and B would have been right. The naloxone can be used as an antidote for pethidine, morphine, fentanyl, but why not buprenorphine? Basically it is a partial agonistic activity. So if you use an antidote like naloxone, it only partially reverses the effects of buprenorphine, not completely. That's the reason you can't use naloxone, which is an opioid antagonist, against the buprenorphine really that successfully as much as you can do for pethidine or fentanyl or morphine is what need to be remembered. Vestibulo-Ocular Reflex is basically function of which part of the cerebellum is a very, very interesting question. Can you tell me, doctor, what is one diagnosis which is threatening and it is a common domain for a ENT surgeon, physician, neurologist? Vertigo. Your vertiginous patient will be, whole world will be revolving. The worst experience anyone can have. Once I had a viral vestibular neuritis. I distinctly remember having vertigo. So very threatening experience. I was in just the end of the first year of MD. So first year of MD means you have a lot of donkey work to do, not a relaxed part of the life. So as you walk, suddenly the world starts twisting around you. And what is so characteristic of vestibular neuritis? Post viral, there is no deafness, only vertigo will be there. That is a differentiator. But vertigo in elderly people, it can be due to any cerebrovascular accident, it can be a posterior circulation stroke, it can be a simple otolith, anything can be. So you should be quite sure.